Welcome, everybody. And today I am so glad to have with us Mitchell Fong. He's the director of telehealth at Renown Health. You know, one of the questions that a lot of people that we interact with is what goes into being a telehealth director or a telehealth coordinator? What's that role like? What should you have to know to be able to be effective in that position? What are the responsibilities, and what's been helpful to other telehealth coordinators and directors? So again, Mitchell Fong at Renown Health. Renown Health is a multi-hospital system located in northern Nevada and the largest not-for-profit healthcare network in northern Nevada. Renown began their telehealth program in 2012, so they're an early adopter. And they've been delivering quality digital care to partners across the state and Eastern Sierra Nevada communities. Renown's vision is to make a genuine difference in the health and well-being of people and communities that they serve. So Mitchell Fong, he's been in healthcare for over a decade. He studied molecular biology at the University of California, San Diego, before pursuing a master's degree in public health at the University of Nevada, Reno, with a focus in epidemiology. That's a difficult word to say sometimes. And there he studied the opportunity and the need for telehealth in rural Nevada in 2013. He also obtained his MBA from the University of Nevada, Reno. As a public and population health professional, Mitchell has been able to help and create the strategic plans for the population health vision and is dedicated to his mission of improving the health care of the community, no matter how small or large the community may be. So he is certainly an expert on population health and telehealth and getting services to those that really need it. So Mitchell, thank you so much for joining us. This is great. Glad to have you here.
Absolutely. Thank you, Ray. Really appreciate the opportunity and always excited when I can talk shop about telehealth.
Yeah. So, I could see that, with your degrees, your education, you kind of got focused on what you want. It looks like you were probably eyeballing something and said, hey, these are the skills and information I'm going to need to be really effective in the career that I'm positioning myself for. In regards to getting into telehealth and being a telehealth director, that's a pretty great position. How did you end up in that position? What led you there? Was it a process? Was it an all of a sudden thing? How'd that turn out?
Yeah, it was definitely a process. I would say I was blessed with an opportunity to stick with the organization that I started my research in, as you alluded to, back in 2012. When Renown was standing up a pilot program, I was doing my research on the need for telehealth in rural Nevada. And at that point, I just wanted to do something that was meaningful, something that was new, but something that would ultimately impact the care for the community. And telehealth was, I would be very transparent and say I didn't know much about it, but the idea and concept sounded really cool. So I took that, pursued it, did a little more research, and I was blessed to bounce around the organization. Definitely took some time to grow and develop. I've moved around from the finance side while I got my MBA to the operations side, hospital and outpatient. And I think really culminating that into the population health strategic planning role that I had prior to this role, that really helped me develop the skill set to understand from a broader picture, how can telehealth be used in a way to drive efficiency, to close care gaps, and to improve the quality of care. And ultimately, I think going that full circle route, understanding how it impacts the other areas of the health system, that was integral for me taking this opportunity. But I'll also just say that I do believe that I was lucky. And some of that has to come with persistence.
Yeah.
I think telehealth has been around for a while, but not adopted as heavily as it should have been. And I think that being that bug in the ear of others around the organization of constantly continuing to ask, where can we potentially use telehealth more, allowed me to be in this role.
Yeah. So you were looking at the very broad picture of healthcare and how to create really impactful change. And you said, hey, this telehealth thing looks like it could definitely have an impact on the very big picture, everyone's healthcare. So yeah, and here we are, right? So now everyone's using it, and it definitely has that impact, and research shows that. So your training definitely kind of set you up to be able to be effective. So you kind of create the conditions to allow you to be a fit for these positions, and persevered, worked hard, stayed focused on this particular niche. Is that right?
Yeah, absolutely. And I love the word you said, persevere, because I really think in any startup, and I kind of view telehealth as the startup of healthcare. I think we really should approach it very similar to the tech industry, where you're looking to validate what you can do, and you're looking to drive change in a disruptive manner. And I think being
Mm-hmm.
persistent is one of those key elements for those innovators, for those entrepreneurs, and ultimately for us in the disruptor industry. And it's not about changing necessarily what our goals are in healthcare, but it's about innovating in ways that we can leverage the technology. So completely agree. Love the word persistent and persevere, because I think those two words definitely go hand in hand with pushing forward. And the personality that's really needed is likely to drive change, to drive adoption amongst providers that were not trained over computers, that were trained to physically use touch.
Yeah, we definitely identify with perseverance. Myself, I do within my business. We've been doing this for a while, and definitely felt like, persistent. And then, COVID-19, and people start to become more aware of it. And, but we worked for many years prior to that, trying to get more implementation, and figuring out how to do this really well in a way that's easy for people. Yeah. So, now that you guys have launched a while back, right? But your utilization has probably gone up a lot. Uh, so I wonder, what are the successes? This kind of goes along with your motivation to get into this. I wonder if you have if you knew someone personally, or a community or something like that, where you were thinking, these people really need access and they don't have it. I wonder if there was anything like that in your story, or just in your successes with the program, how you've seen it truly impact communities.
Yeah, that's a great question. And I'll say that it's multifold. As you alluded to, I think certain communities definitely it hits home. In Nevada, as I was doing my research, and it still stands today, we're seventh largest state in size, but 47th or 48th in provider access. And if we think about that, we really have two density hubs in our state: the northern area where we're located in Reno, and the southern tip in Las Vegas. But the rest of the state, 14 out of 17 counties, are considered frontier, even more remote than rural. So
Wow.
those communities have no access to specialists. Hearing stories of patients driving 2.5 hours each way, potentially getting caught in the middle of a snowstorm for a 20-minute follow-up cardiology visit. I
Oh,
mean, when we really think about the value of that, I think the risk of the patient driving through the snowstorm potentially could have outweighed some of that value in certain instances. And that's not to take light on any of the interaction that occurs during that consult, but
yeah.
can that be done via telemedicine and deliver the same outcome rather than put the patient through the risk of driving 2.5 hours in a snowstorm? So I'll
Right.
say that that was probably the first story that really made it stick, that, wow, this is incredible, the impact that telehealth can have. And it's more robust than I could have even imagined. But then as we really think of it now, particularly with COVID coming into the urban settings more and more frequently, and we think about parents that don't have the ability to take their kids to school when the doctors are kids from school to the doctor's office when they're
Yeah.
still open. When we think about the opportunity invasion in the urban lifestyle, I think we're really thinking about the opportunity to move towards value and drive preventive medicine. Ultimately, that should be our goal. I think COVID has really helped us shed light on the fact that prioritizing our resources and creating the right capacity within our brick and mortar locations as communities is going to be extremely important. And at Renown, we're the only level 2 trauma center between Sacramento and Salt Lake City, which is over 100,000 square mile radius. So if we think of the impact that we really have to prioritize and ensure we have the right capacity within our facilities to deliver the care for the entire community.
Right. So are you guys utilizing a lot of remote monitoring then?
You
But
know,
rather than people in the hospital, just really keeping a close eye on them from home?
at this point, we're looking to relaunch that program. We had that program launched, and we had less buy-in than we wanted to. And I think with the policies and the reimbursement laws at that time, there were some restrictions for how we were able to roll it out in the urban setting. But I think post-COVID, we're really excited, and we're actively right now in the process of deploying that. We really feel like that would be extremely impactful. Instead of remote monitoring, we've really stood up and expanded our virtual visit opportunities. And that's been extremely impactful in keeping patients out of the hospital, out of the ED, and getting the care to them directly in their home as much as possible.
Right. Yeah. And what have been some of the challenges to increasing the utilization of the telehealth services?
I think just adoption of technology, it's new in general. So I think there's a learning curve, and that's been one of the biggest things. Ultimately, historically, there's been a stigma. Doing healthcare over a camera isn't as good. It won't provide the same level of quality as it will in person. And I think what we're learning for a lot of these specialties is it absolutely can deliver the same quality. And for a lot of the services and needs of the patients, some of these low acuity urgent care visits that they're having, they really can be addressed completely from home through a virtual visit. So I think addressing that stigma was one of the earliest challenges, and getting providers comfortable with the technology.
Yeah, stigma on the clinician's end, or reimbursement end, or the patient's end.
It's a great question. It's actually on all three. I think with COVID, we've seen some expansion of legal waivers, reimbursement, and policies, which has really fostered the adoption of telemedicine and virtual. But I think historically, it's been both from a patient and a provider perspective. And the good part, if you will, of COVID is that we've been able to push forward to demonstrate that we can deliver services through the technology that exists, and patients and providers are able to have a good experience today. So I think if there is any positive with COVID, that's one of the best things for the telemedicine industry.
Yeah, once you know you need to do it, you're going to do it, right? You're going to get over the stigma and do it.
Right.
Yeah. What about the access to technology on the client's end? So I know someone right now that needs a dermatology visit, and they can't get there. They don't have someone to give them a ride. So I thought, well, hey, dermatology through video, that seems pretty common sense for the examination. Obviously, if you have to get something taken care of, lasered off, or frozen off, or whatever, you need to, or surgery or whatever, you need to go on site. But other visits, like having a stethoscope or a otoscope or a camera, or even with dermatology, I can't say there's a spot on my back using the selfie stick, right? There it is. Right? So but just having the technology on hand at the client's end, what's been your experience with that?
Yeah, definitely. It's amazingly impactful what the difference is between having those peripheral tools and not. And I'll say that virtual visits without those, extremely impactful. Virtual visits with them, I'd say very comparable, if not identical, to some of the in-office appointments, particularly based on the specialty. And as you pointed out, the ability to have those Bluetooth stethoscopes. So our providers are listening to the heartbeat of patients 200 miles away in real time, in high quality, being able to look into their ears, their eyes, their nose, and throats, and use a dermatoscope over Bluetooth. It's amazing what technology can do these days, and really enhance that. The ability for asynchronous telemedicine comes to mind as you share that, and that's the ability to store and forward, or take a still image and send it to the provider. And I think really, it's particularly in dermatology, when you think about that opportunity for a patient to just take a few pictures of what's going on in their skin, send it to the providers, and then providers, let's say it's an urgent care provider or dermatology provider, they have a no-show. They now, instead of having that wasted scheduled time, they can use that to address patients that are waiting in the queue, and prevent unnecessary utilization potentially.
Yeah. So hopefully there will be a talk about population health and creating change within communities. Hopefully more and more households will get these basic peripherals to be able to get some, really good telemedicine visits without having to go in. Even like myself, I used an EKG machine. All it is a teeny little stick like this, looks like the size of a stick of gum. I just put my fingers on it like this and EKG, full EKG to the cardiologist. Yeah, it's pretty incredible. So moving forward, what are the things that you think as a community, healthcare community, we're working on to get to the next step, or what challenges is it that we're trying to overcome currently?
Yeah, I think the biggest challenge is reimbursement. And I think with COVID, we've seen the waivers and the expansions, and there's been a lot of positive with that. But I think that's the first and foremost thing that we need to address: the state licensure, the reimbursement, basically all the policies that are restrictive of telemedicine and that don't create parity. Ultimately, what we need to do is have parity between telemedicine and in-office visits, from
Yes.
both the service coverage and a reimbursement standpoint. To me, that's the biggest barrier. From there, I really think the access will be a challenge for healthcare providers, but they can work it out. If the reimbursement is there, it just becomes a part of the workflow.
Yes.
But
Yeah.
I really love the quality piece too, because I think one of the biggest concerns and something we're doing is reevaluating. During COVID, we've had to do a lot of very quick launches, and that was awesome and amazing to meet the need in the interim. And we don't want to lose any momentum from that, but there is a need to reevaluate what was done on a short-term instance to make sure it's going to meet your long-term sustainability goals. And so I think that's the other concern with any organizations that have stood anything up specific to COVID. It's making sure you're doing it with the right quality, the right vision, and the right backbone, if you will, so that you set yourself up for sustainability and continued program expansion downstream.
Yeah. And what about you in your role as telehealth coordinator? You're working with an organization, you're working with an IT team, you're working with clinical staff, telehealth facilitators, admins. So you are kind of bringing everyone together on the same page, same goals, the same procedures. What's that process been like for you?
Yeah, it's definitely a challenge. And I would say the biggest thing is be persistent, but be transparent and open. You have to be a good collaborator, and you have to be a model for what you want your product to be.
Mhm.
So if that means meeting via video during
Yeah.
COVID for all of our meetings, that means encouraging everybody to jump on the video meeting and use video. I know it's new for some, and for some of those providers, it's going to be a challenge, but it's something that we really need to start encouraging, is that video is just a part of healthcare now. It's no different. So I
Yeah.
think that's definitely one of the biggest challenges and opportunities as we continue to move forward.
Yeah. And since you guys have been working on this longer than most, being early adopters, any learnings that you'd like to share with other organizations looking at continuing to develop their telehealth services?
Yeah, absolutely. I think it's teamwork, it's collaboration, and it's pushing for what's not easy. And we know change is not easy, so you're going to have to be persistent. But having those key metrics, really pick and define what is the value that you want to deliver to the patient. Track those metrics, start with a clear baseline, and then track that over time to ensure and validate that what you're pursuing is really impacting those key metrics. There will be a learning curve, but collaboration and getting provider buy-in is extremely important. I
Mhm.
highly recommend finding physician champions, because ultimately that's going to be the drivers of success. And one thing that we're currently really working on is website manner. I think providers become more comfortable if they get the right training and they understand why it's so impactful on the other end. And
Yeah.
so delivering that training, making your care team feel supported and encouraged to use the technology, while also ensuring that you guys have shared goals and shared vision, that's going to be the key to delivering the outcome that you want.
Yeah, yeah. Just to give people an example, I was on a telehealth visit with a physician not long ago at all, and the physician was going like this. We're talking, then they go like this. You know, I'm like, what is he looking at? Like, who else is in the room, right? And so, yeah, just getting some training on the web manners is definitely important. In terms of matrix and looking at what's the result of your telehealth program, can you share maybe one metric that you were tracking that demonstrated the importance of your telehealth program?
Yeah, I think there's a couple different metrics that we really track to determine our impact. And I think one of them is our conversion rate. And with this, we work with each of our specialties to define the different referral reasons that they'd be willing to see new patients via telemedicine.
Uh-huh.
And so trying to refine that algorithm to create efficiencies is very important for us. So defining the percentage of success with that algorithm, how many of those referrals from those communities that were flagged for telemedicine were actually appropriate for telemedicine, that's been extremely impactful for us. We've seen it drive our no-show rate, our cancellation rates, and our overall productivity for our provider schedules, just because of some of the efficiencies we've been able to gain from that. And that's just a small example.
That's a really important metric to have right away, because you don't want that going on for too long, where if you're getting people referred to a program that are not actually a fit, that could really turn people off.
Absolutely. I would say that was when I stepped into this role, that was one of the biggest complaints from providers from our side was we're getting all these patients scheduled and they're not appropriate for telemedicine. And so it's really defining what's appropriate, what can providers comfortably see, and scheduling that appropriately.
Yeah. Yeah, this has been very, very helpful, Mitchell. I greatly appreciate it. I know that everyone else did. So thank you very much.
Thank you, Ray. Really appreciate the time and encourage everybody out there to keep pushing forward. Telemedicine is here to stay. So please continue to do what you can to help push it forward.
Yes, thank you.
Thank you for your time.